Rifat Atun joins us live from London. He's a professor of global health systems at Harvard University. Thanks so much for speaking to us. You've been able to really keep your eye on the global picture of this pandemic. First, I'd like you to tell me where you think the best cases have been.
In terms of the response, one can identify South Korea as a country that has responded extremely well with early introduction of social distancing, aggressive testing, isolation, and quarantining of infected and exposed individuals. And they were very quick to bend the curve, and they've been able to maintain that. And also the number of deaths have been rather low. This is in contrast to several European countries that were late in their response, that led to a rapid rise in the number of cases and a rapid rise in the number of deaths, such as Italy and Spain. And of course, we're now seeing a massive rise in the United States with a huge increase in the numbers as well as number of deaths.
Why do you think there is this discrepancy? These are all democratic, developed countries. Why would one be able to respond so quickly and so thoroughly, and the rest seem to have dropped the ball?
Yes, excellent question. So the first, there's the availability of data. In many countries, there was not enough testing, so it was not possible to know how many cases there were and the community level transmission of the virus. So we saw in Italy and Spain, and now in France, the numbers rising very quickly. Whereas Germany introduced testing very early and very aggressively. And although the numbers are rising because the reported numbers are rising because there are many more tests developed, the death rates in Germany are quite low. Now, one of the reasons of the delayed response is leadership. Leaders have to balance cost in terms of health and number of deaths with economic and social consequences, and each country have different priorities. Those that have prioritized their the health and well-being of their populations have acted early. Those that try to maintain their economies at the same time have acted somewhat later.
And then why do you think a country like Turkey, not as wealthy as its European counterparts or the United States, seems to be doing a relatively good job on stopping their hospitals, first of all, from being overwhelmed and keeping the infection rate slightly lower?
Yes, Turkey has had good experience from the earlier SARS epidemic. They were very quick to respond, and they gained very good experience in developing protocols for rapid response and rapid reaction. They've also gained experience in terms of rapid response in relation to earthquakes. So this has enabled Turkey to introduce changes very quickly, but have a very good command chain from the top to the rest of the country that could be implemented very quickly. And you're absolutely right. Turkey did act early in terms of closing schools, reducing mixing of young people with old people, and we're seeing the benefits of that. Although the total number of COVID cases in Turkey are currently lower than that in the United Kingdom and France, but we don't know exactly how many cases there are because the number of tests performed in Turkey is far lower than that in the United Kingdom or France or Germany or Italy.
I need to ask you a question about testing in particular on a global scale. It frustrates me greatly when we keep reporting, the number of confirmed cases per country, because it really is more of a question of per capita. Why can't these wealthy countries get the same per capita numbers? And I'm particularly talking about the United States, where the president continues to brag about doing more testing than anywhere in the world, when per capita they really haven't. But why can't the wealthiest country on the planet get access to those tests and get them distributed?
I think they acted very late, and the response in many countries have been very, very disappointing. with terrible consequences for individuals, especially the vulnerable populations who have not had access to testing, but also hospital care. Many countries acted late. Then there was a shortage of not just the equipment for testing, but also the materials that are needed for testing. And then the supply chains became interrupted. So a series of events came together to create a perfect storm with huge demand, but limited supply and interruption of supply chains.
Is it excusable?
Absolutely not.
Okay, Rifat Atun, unfortunately, we're going to have to leave it there. Thank you so much for joining us. We appreciate it.